I want to say how impressed I am to see so many well-groomed young men in the audience today. And just out of curiosity, I'm just wanting to know what ages are here. So how many people here are in middle school? Okay, and then high school? Okay, so it's about 50-50. So what I'm going to talk about today is the teens and their skin. And basically, I'm telling you pretty much what are the most common complaints that people show up in our office. So we're going to just look at some of the things and talk through them. You can ask questions if you have any at the end of the presentation. Okay? All right, so you already gave me a fantastic introduction. Thank you so much. So because I've been in practice for almost 25 years and practiced all over the country, I've had an opportunity to see all types of patients and skin problems from all walks of life, from celebrities in Beverly Hills to farmers in North Carolina. What are the top teen complaints? Number one is definitely, absolutely acne. That's the most common complaint in our office in your age group for both males and females. And acne is caused by several features that can be triggered for various reasons. Number one is hormones, which you may know what that is. Stress is another one, especially the high school students are experiencing some of that. Hereditary factors, that means if it runs in your family, there's more of a chance of you having the problem. Sweating and sports gear. I know I probably have a lot of athletes here in the office, and sometimes with the sweating, with basketball or football, wearing all the gear, and especially the helmets, it can set you up to have a lot of breakouts. And lastly, not so much for the guys, but makeup and styling agents for the hair can also be a cause of teenage acne. So the acne itself is caused by three major factors, and one is the overproduction of oil in the skin. This is not a bad thing, but in acne you get blockage of the hair follicles that release the oil, and then you get a growth of a bacteria underneath the skin called P. acnes, and that's what sets you up to get the pimples. We recommend many ways that you could treat acne with topical agents, oral medications, and sometimes a combination of both. But the first line in treating any acne patient is trying to determine the severity of the problem. So from a teen standpoint, any acne is bad. But not all acne patients have the same degree of activity, and I'm going to show you some examples. So you can't see this really well, but mild acne is characterized by the occasional clogged pores. Is there a pointer? Okay. Clogged pores and small breakouts. It's a little fuzzy, but at the top forehead you can see there's a little bit of bump formation. This type of acne can often be treated with over-the-counter products, which are easily available in the drugstores. There's Proactive, you've probably all heard of that. There are BPO products, which are benzoyl peroxide, which will come as washes and topicals. There's salicylic acid, which is a medication that's found either in a wash or a spot therapy. There are Clarisonic facial systems, which are little handheld scrubs that you could use on your face to get a good cleanse off the surface of the skin. And then there are also mild scrubs and exfoliants that you can also buy in the pharmacy. So mild acne treatment this is actually mild acne. Okay, it looks like a lot's going on. So occasionally when the over-the-counter medications aren't working, a dermatologist will prescribe medications to reduce the inflammation and unclog the pores. And in this individual, I don't think the pointer is working. You can see on their forehead, they have lots of little bumps all throughout, very, very diffusely across the whole forehead. This patient may not clear up with just over-the-counter products. So we go on to what would we give this type of patient. Because this is still considered mild, we only want you to use topical preparations which would be prescribed by the doctor, some of which are called retinoids that are needed to unclog those little pores that you saw in the previous picture, topical antibiotics which come as gels or washes or swabs to reduce the bacteria in the skin, and then also benzoyl peroxide products to reduce inflammation. So most of these treatments are actually easy to use and also easy to tolerate. However, it may take several weeks to see the results, and it's important to be patient and consistent, which we do find is a bit of a challenge in your age group. But if you do follow through, you will begin to see results. So now we're going to a more severe situation where people who get this type of acne have more inflammation in the skin that can result in bumps that are often red and occasionally painful. So you could see this person's cheek, they have larger bumps. Unfortunately, the visual isn't that clear. And it can get worse. It can be widespread. It can be very red and inflammatory. It can involve, I don't know if you can see this, guys, but it's actually somebody's back. Can you see that? Okay. I wish I had a clearer picture. I guess I can't refocus it. But believe it or not, acne can get this bad. It's very widespread cystic acne. It can involve the back and chest. And this patient, of course, has to be treated with more severe medications that definitely would have to be prescribed by a doctor. The first line of defense is, again, the topical medicines that we talked about earlier, oral antibiotics. Oftentimes these are pills or tablets that you have to take daily to get that kind of bad acne to respond. And then there's a very, very strong medication, which hopefully none of you will ever need, but it's called isotretinoin or Accutane. And that medication has lots of side effects and requires a lot of monitoring, and we only use it in the worst case scenarios. Lastly, there are other things that can be done in the doctor's office, which are peels, which is just pulling off the dead surface layer of the skin, something called extractions, where they actually remove the blackheads. I know it sounds bad, but it's helpful. And then there's laser therapy. Okay, so if you're under the dermatologist's care, it's important to, one, remember to do your treatment. I can't tell you how many times I've had patients come in with a parent complaining that they're not getting better. And with questioning, what do we find out? The mom or dad is worried because their son or daughter isn't improving, yet with me asking a lot of questions, I find out they're not doing their treatment, or they're not doing it consistently, or they're doing it incorrectly. So it is important to remember to do it. Number two, when you're using facial washes, we want you to use something relatively mild and not an aggressive scrub, particularly if you're already on treatment, and we want you to avoid picking. I know there's a big temptation to actually try to remove the pimple, but that actually can make matters worse. It can turn a little pimple into a big one, and the big pimples often leave discoloration in the skin, which is very, very pronounced when you have pigmented skin. Also we ask you to drink lots of water, okay? That does not mean soda, that does not mean juice, that does not mean Gatorade. It means water. Water is the only thing that seems to help with this situation, flush your system, and help your skin improve. And then, of course, if you have any side effects, you want to report those if they occur. So, this is the next most common problem that dermatologists sees in teen boys. Can you see this? What does it look like? There's coloration on the back. And what color is it? White. So in this slide, can you see it? What does it look like? We're looking at the spots, guys. Here is a video. It's hard to see. We don't have the greatest, it's a little too light for this picture. But these are the same type of spots, except they look kind of brown. And then in another case, you can see a widespread activity on the back. And this is a condition that we see that's called tinea versicolor, and it's a very common form of a fungal infection in the skin. It's extremely common, but we only see this in the office when the patient actually notices the spots on their skin. So these spots, as you saw in the pictures, can appear different colors: white, brown, red, and it's caused by a common yeast that lives in the sweat glands. So we most commonly see this condition in athletes during sports season, in the summer when shirts are off at the beach or the pool, or if you develop symptoms like itching or burning. So this is something that is easily treated, and the treatment options can be as easy as using Selsun Blue shampoo or a tea tree oil shampoo in the shower. Sometimes we give patients medication for this. It clears it fairly quickly, and in worst case scenarios, a pill. Many times this will just resolve on its own without any treatment, but unfortunately, in most cases, it will recur and come back because there's no cure for this. It's actually a normal thing to have in your skin, so if you actually see it, you can either try the shampoos or talk to your parents. You might need treatment. Next up is another condition that we call eczema. Again, not great, but you can see there's lots of little bumps on the skin. Can you see that? Okay, that's a bad picture. I can't even tell what's going on. This is eczema in... I was kind to these guys. I gave them nice pictures. It could be so much worse. I'm sorry. Okay, so you can appreciate that this could be a problem in the skin that some people have, and eczema is not fun. Okay, eczema is the itchy, red, dry, scaly, bumpy, or thickened plaques in the skin that can really pretty much occur anywhere. Most eczema patients are very, very uncomfortable when the disease is active and they want to get some relief. Teens with eczema often have siblings or parents with eczema, or they have very dry skin, allergies, hay fever, or asthma. So this is something that can be treated quite easily. So here's some advice if you have this particular problem. And number one is what I tell all my teen patients. Avoid super hot water in the bath or shower. How many of you are taking showers with super hot water? Raise your hand. I know. It's like, what's the point of getting in the shower if you can't get in there with hot water? We get that. But if you have really dry skin or you have these skin conditions, it's really important to avoid super long showers. Sometimes, what's the average time that a teen will tell me they're in the shower? Anywhere between 20 to 30 minutes, which is kind of crazy. What was that? An hour. Wow. Okay. Hour. So you're a guy with a lot of time in the morning. You could get up and take an hour shower before you get out of the door. Our average recommendation, if you have problems with your skin, believe it or not, I hope you're listening over there, is 5 to 7 minutes. 5 to 7 minutes, guys. 5 to 7 minutes is all it takes to get clean, okay, and not strip your skin of all the oils that are on the surface of the skin that are helpful for drying your skin out. We also recommend that you try to use unscented lotions and creams on your skin every day after your bath or shower, and avoid using too many heavily scented products on your skin like Axe, etc. Uh-oh, there was a clap over here from 2 claps. Avoid Axe. There are probably others, that was the only one I could think of. Okay, and then if you happen to have this problem with the dry, itchy skin, we also want you to avoid wearing anything that's going to make your skin feel itchy, like certain wools or nubby fibers and synthetic fibers. Anything that starts you itching will make you scratch. Anything that makes you scratch may bring out this eczema. So we're just giving you some advice here for some easy tips. So we're moving on. I just think I just really toned down this lecture so much for you guys. It could be so much worse, okay? So these are called keloids. Keloids are scars that can develop from any trauma to the skin, okay? So keloids can happen from surgery. Keloid can happen from athletic injuries. Keloids can even happen from shaving. Keloids can happen from piercings of any type. So I'm going to just show you this picture. I don't know if you could see it. Down here. I guess you can see it. So that is a type of earlobe keloid, okay? And I've seen this type of keloid on the rise since more teens, both males and females, have pierced ears. So we see keloids from piercing of the nipple and the belly button and even in tattoos. That can happen, believe me. The sad news here is if you get one keloid, you'll probably have a much higher chance of getting another one. There are very effective treatments for keloids. They can be injected with steroids or removed, but so far nothing works 100% of the time. So this is keloids in the back of the neck. These are all bumps that are forming on the back of a man's neck. And this condition has a special name. It's called acne keloidalis nuchae. And these are when hair follicle bumps form on the back of the neck, usually from a haircut. That's all it takes for somebody to go from nothing to that. Sometimes the hair follicle bumps will not heal and they'll turn into keloids on the back of the neck. Teens who develop this condition can be treated with medicated shampoos, topical antibiotics, sulfur lotions, and sometimes steroid injections. I know it sounds terrible, but it does help. And often this is recurrent, so if the bumps do begin to occur, make sure you talk to your barber about it and make adjustments to how often you get your hair cut or what type of cut you choose. All right, so the bumps can also occur from shaving. So just out of curiosity, how many guys in the room are shaving? Okay, so there are a few, and in a few years there are going to be a few more and a few more from that. So this is something that most men end up doing throughout their lifetime, and the development of the bumps can happen regardless of how you choose to shave. So you could use a straight edge razor, a double edge razor, you could use an electric razor, you could use a clipper, and you could still get bumps. So all of the above, these things that I just mentioned for hair removal on the face, are what the doctors call PFB. You might have heard of that. So this is a good example of PFB. This is a person who's got lots of little bumps, mostly in the beard area. You can almost see the hair where the bumps are forming. Again, maybe not. All right, so pseudofolliculitis barbae, that's what this condition is called, and it literally means bumps in the hair follicles caused by shaving. So it can occur in all ethnic groups, so we see this in everyone, but it's most common in African American men due to the nature of the thick or curly and kinky hair. What happens is the act of shaving causes the hair to curl back on itself into the skin, and that results in the red, painful bump. This happens most commonly in African Americans since the majority of the hairs are already curly. When it's cut, there's a greater chance that several or many hairs will curl back on themselves back into the skin. There's treatment for this. And the first solution at home may be to try to release the hair from the bump with the tweezers. I should put a little caveat in there and say gently remove, because the more aggressive you are with this, you'll see it as we go along, it can get worse. There are other treatments that are available. You might have heard some of these, or your older brothers or dad might be using one of these. There's salicylic acid solutions called Bump Stopper or Ten Skin, and those are very helpful to dry up those little bumps before they get worse. You can easily find that in the drugstore. Our best advice again, try not to pick. Maybe we're going to go over that one more time, because the picking can often result in getting a larger bump or worse, and the inflammation can lead to the discoloration in the skin, which we're actively trying to avoid. So you want to, as you get into shaving and learning how to shave on a more regular basis, you want to maybe experiment with various shaving techniques to see which one works best for you. One stop doesn't fit all, so you just have to see. You might be the guy who needs the electric razor. You might be the guy who'll do fine with a double edge razor. And you have to find what works best for you and your growth pattern in your beard. Okay, so I just want to say you're not alone. Many of our teen patients are very self-conscious and embarrassed by having some of these conditions that I just discussed. If you realize that you're not alone and know that there's either treatment or time will take to improve the situation, we urge you to talk to your family, share your concerns with your family doctor. Often there are easy treatments that can make dealing with this and some of these issues are a lot easier to go through. Our society seems to idolize perfection, so it's not surprising that most teens are looking for that, as well as many adults. Teens tend to be very harsh critics on themselves, and also others around them. A lot of teasing around some of these issues. So in conclusion, it's important to strive to be your best self. Your appearance is part of this goal. Your parents, your mentors, your teachers, your counselors, they all want you to achieve your goal and reach your potential. With all the negativity in the news with regards to black males these days, it's important to be mindful of the image that you present to the world. In the workplace, there's often a culture in place that's unspoken, but there's an expectation of conforming. So appearance does count. In my office, most of the employees who deal with the public have to wear uniforms, but the uniform requirement only came around when just one employee continued to wear attire that was inappropriate for the workplace. In certain careers, facial hair and certain hairstyles like dreadlocks are either frowned upon or banned, especially in law enforcement. I have lots of police officers who have to come into the office and get a waiver to not have to shave their beard every day because they're having those problems that I showed you in the pictures with the PFB. So here's the reality. It is a reality that your appearance makes a first impression, either good or bad. People who don't know you make judgments about you based on your clothing, your grooming, and your speech. So be prepared. Just giving you an example, I only have a daughter, no sons. When my daughter was preparing for a business internship, when she was in high school, she was unclear about the need for pantyhose. She basically didn't know what they were. What have you? But she is something that women are required or are expected to wear in the workplace, and she had no idea what it was. As you might not even know what's appropriate for the workplace, like no hoodies or sagging. You might not know how to tie a tie. It's important to learn these skills. So take time to explore your options, learn what you can here, and work on getting into the habit of taking care of your appearance. Make this your priority and not your family's. That's another struggle that I have a lot in my office, where the parents are very motivated to have their sons and daughters, of course, look better or get better, and the patient themselves, who's a teenager, is rarely following through. So it's really your priority, not your parents, to do these treatments. So find a family member, a teacher, counselor to be your mentor. Their guidance and experience can be invaluable to you in helping you find success, both now and in the future. Okay.
At this time, we're going to open it up to questions for Dr. Walker, so anybody in the audience, that includes parents, if you have questions for Dr. Walker. Stand up and say your name and ask your question.
You thinking about it? All right, any other questions?
What do you think about putting fruit on your skin?
I didn't.
Like natural fruit, like lemons.
Fruit on your skin.
Yeah.
Well, believe it or not, a lot of the products that work really well for particularly acne are fruit-based acids. And these are acids that are found in nature. They're in milk, they're in grapes. Lemon, not so much. That's a little acidic, and it doesn't actually have any benefit immediately in the skin. Yeah.
Can't hear you. Sorry. Speak up.
My name is Robert from like I wanted to home remedy with like your
That's a good question, actually. There are lots of home remedies out there, like the lemon juice, there's toothpaste, there's what was I lost my train of thought, that people use at home. Sometimes you can, there's aloe vera gel from the aloe plant, that's another big one. that a lot of people use. Can you give me an example of something that you were thinking about? That you use at home, a home remedy? Seaweed. Okay, now that's one I haven't heard of. So there are probably a lot of things out there, and you all have access to the internet, and anybody can tell you anything is helpful, and that's part of the problem, because you don't know what's gonna work for you. If you do try some of these things, sometimes they can end up creating more problems than it's worth. You've certainly seen people have allergic reactions and burn their skin from doing things that they thought would help to just dry up a pimple. Then they end up in our office with a bigger problem. So I'm not saying that some of these things might not be helpful, but if you keep going and you find that it's not working for you, once you talk to your parents and see a doctor. Sure.
Does washing your hands play any part in, having?
Transmitting. The hands play the biggest part in picking. Okay, so that's where, in a teenage group, that's the biggest issue. The desire to make something go away that's there and try to manipulate it away. The hands themselves, of course, should be washed, and the amount of bacteria that's transmitted to the skin from the face, that certainly can happen, but it's really not that much of an issue.
Earlier you mentioned water.
Excuse me?
You mentioned water earlier. How much
Yeah.
water do you recommend a teenager?
Well,
Drink per
in
day.
this age group, if we can get 6 to 8 glasses of water in a day, that would be great. That seems, I see all the looks of surprise. I know it seems like a lot, but that's what would be the best for your health and your skin. Now, some guys actually substitute that water requirement, they use Gatorade if they're at a game, etc. But just plain water is still the best and the cheapest thing to use, to drink. So 6 to 8 glasses a day. In the back? Oh, any of the students? Go ahead.
You know how you talked about like when people are getting haircuts and they catch bumps? How common is that?
That's an excellent question. I would say it's not as common as I would make you believe from the pictures, but it probably happens in 1 in 10 guys that they'll get at least a bump or two from the barber.
Is that from dirty razors or?
It isn't, it's from the act of cutting the skin. So a lot of guys go back and they get mad at their barber and say, look what you did to me, but sometimes you might ask for a very, very close cut or a fade cut, and the barber keeps bringing the hair shorter and shorter, closer and closer to the skin, and the act of cutting the hair so close can create the bump.
Bar or soap versus body wash?
Say that again, bar soap versus
Body wash.
body wash?
Right, and what type of soap would you recommend to prevent some of the dryness that you identified?
Okay, that's a good question. Actually, bar soaps and body washes can be quite similar, but there are certain types of body washes that we do want you to think about avoiding if you have some of these problems with dry skin or eczema. And those are the body washes that tend to have the most fragrance. Those are really drying. They're actually detergents like your mom uses in the sink to wash the dishes, and they kind of suds it up. Put a lot of surfactants in it to make it bubbly, and basically it's stripping your skin of the oils. So if we were going to recommend the type of soaps that you would use, I did bring some samples. There are certain product lines like Dove, Neutrogena, Aveeno, and Cetaphil that have great products if you're having those type of problems with your skin. And you're welcome to try some of the samples. We bought some dry skin, I have one. We bought some dry skin lotion samples as well.
You talked about how like having hair and like not dressing can ruin your chance of getting a job. What about like acne and things like the things you can't control, like acne and the keloid skin? how does that affect your chance of getting a job?
That's an excellent question. And you know, it doesn't affect getting the job quite as much as it affects the person's self-esteem or affects the person's self-consciousness. So it affects their confidence. And I think that has a lot to do with, you know, the need to have treatment for these things so you can gain some of that control over the situation. But I don't think that the employers, especially in your age group or the internships, they focus as much on some of these issues. They understand that it's out of your control. But I have seen the older, maybe a little bit older group of teens than you, patients who've gone through from some of the worst case scenario acne to basically clear, and they will admit to me that it's made a big difference in how they feel about themselves, for the better. But it's an excellent question. I'm not in HR, and I'm not the one doing hiring, so, you know, there are certain discriminatory things that you cannot ask or say or make a judgment about, and that's what, those are in that category, acne and keloids. Tattoos, I don't know. That's a visible sign that people will see, and they may make a judgment about you, even if it's unspoken, depending on where it is and what it is. I had a staff member who had to wear her hair down at work because for some odd reason, she decided when she was much younger, maybe a little older than you, that she was in love with a guy named Edgar, and she tattooed his name across the back of her neck in big black Gothic letters. This is something you have to hide. People are going to make a judgment about you. Who's Edgar? And why is he on the back of your neck? I'm just saying.